Good evening, everybody. I'll start off with a simple thing. I know I'm not philosophical or trying to talk it because I remembered just because 2 years back I was in Hyderabad and there was this pediatric cardiac symposium and where there was a big debate about since because perimembranous VSDs are so easy to close, should the indications for VSD closure change? So same when you have a CTO meeting, the same logics creep up, and I always felt this is very appropriate that very often people who think whatever is easy is indicated and whatever is difficult we try to find reasons why it should not be done. Coming to when I thought of Slender, there are a lot of things which are included in fact there is a Slender club in Japan which specifically works on how to slenderize the entire system from injections from 3F catheters to 4F sheaths. But then I thought what Google thinks about Slender, then Google thinks this is Slender. Then there is a lot of data about Slender Man. But today we will keep the discussions to the role of Slender systems in terms of guiding catheters and more importantly in terms of guide sheaths that we use. So I thought, what is so new? 10 years back somebody who I revere as one of the pioneers in intervention, Dr. Saito, especially in radial intervention, and he presented something almost 10 years back saying that 4 French guiding can be used for intervention. Then I was looking at even in Indian Art Journal there was an article way back 10 years back about how complex lesions which can be done with systems less than 6 French. So I started wondering whether there is any point in talking about a topic which is almost like 10-12 years old. Then I thought, is there any evidence that using such things makes sense? Obviously, there are a lot of trials where they specifically looked at the Slender system versus the conventional system and what impact it had on complications and vascular access. This I found it little interesting because normally whenever we talk, we always assume that these are studies which, just people who have a lot of experience talk. So this is a very interesting study where they tried to compare the conventional radial sheaths with Slender systems, and the 6 French Slender sheath has a less vascular complications than a conventional 5 French. That's the kind of a take-home message which is really surprising, although the p-values are not significant. The point I'm trying to make is that a Slender 6 French sheath and a 5 French sheath almost works on a similar grounds. That's what the study which was published last year concluded. The important thing which they noted is, which is very interesting, that they noted that when the Slender sheath was used in Japanese population, although it was a multi-center trial, in Japanese population there was a slightly increased incidence of radial artery occlusion compared to the other system, but in non-Japanese people this difference was not observed. I do not know how we correlate with our own population. The thing is, there's nothing special. Many of the previous speakers spoke about the role of Slender guides, sheathless guides. I'll just go through a brief thing. Basically what they have tried to make it is make it as thin-walled as possible to enable success. So whatever we use as a 6 French conventional sheath, same thing, the inner diameter is something which can accommodate a 7 French guide. That's the basic principle with sheaths. When it comes to guiding catheters, these are the examples of a sheathless guiding catheters where the hub makes sure that there is not significant movement while using the device, and it works in a similar way. This is just to compare. I think somebody put up a slide similar to this before, just mentioning how a sheathless guide performs as compared to a conventional sheathing system. This is just to show that 5 French works as perfectly as a 6 French. This is again reiterating the same thing. If you compare the outer diameter of sheaths, if you compare a conventional 5 French Terimo sheath versus a conventional other sheaths, Terimo 5 French sheath would be having a lesser outer diameter. But if you compare a Slender sheath of 5 French, the outer diameter is only 2.13. Similarly, now you go on to the 6 French Terimo Slender sheath, its outer diameter would be 2.46, which is less than the conventional Terimo sheath also. So the point to be highlighted is a Slender sheath system, the outer diameter is so less that it is like a 1 sheath upgrade. This is with the 7 French glide sheath. Even in a 7 French, the same thing, the 7 French slender sheath has an outer diameter which is almost similar to the outer diameter of a conventional 6 French thermo sheath. So this is just to compare across the spectrum of all the companies which manufacture 6 French and 7 French. The point is the same. This is just to put it in a single slide. 5 French, when you compare the introducer sheets on the left side, the outer diameters are given, and when you compare a slender sheet, it's exactly like something like this guideliner concept, one inside one. And this is probably a multi-centered trial. This is probably the largest data. It's not a very big number of patients, only 60 patients. But this is with 7 French slender sheath for complex interventions. So that is what this meeting is all about, complex interventions like CTOs, which need a 7 French as a routine. As Sir mentioned in his talk, that whenever you have a CTO, inevitably we consider femoral approach as our standard of care. This is an example, 60 patients, but still 7 French sheath used as a routine and with a high rate of success in the results. The editorial in the article, for the article by Gilchrist very clearly says, at the end of the day, this larger size may increase the intervention options, but and hazard from vascular damage should be considered. Just to share our own experience with this slender sheath, we have done less than 100 cases with slender sheath, but obviously these were not for complex intervention. Usually what we do is whenever we take patients for a primary, we inevitably use that 5 French sheath. So in that event that usually primaries are less complex interventions than CTOs. So very often we manage with that 5 French sheath because we are able to get a 6 French guide inside it, and very often the procedure is straightforward. Some of the cases where we did an ad hoc intervention also, we have used the sheath and had good success. Our experience with complex intervention is not very huge. Maybe I might have used 7 French in 15 cases and 6 French bilaterally in maybe 8 cases. But the take-home message would be simple. It is not a very big, advancement. It makes your job easier. All the things which are mentioned is whenever you are considering that these things may be required. So going with a 7 French to start off with 6 in 7 makes your job easier. I would like to conclude, but by a simple thing. If you are a CTO operator, as when Dr. Ganesh pointed out complication, it is very natural to get scared. So, but I always feel if you are a good CTO operator, it is always healthy to be having some fear. But most important for a CTO operator is he should never panic.